everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome back to Alzheimer Speaks. I am so excited today because we have a repeat guest who was absolutely fabulous last time she was on the show, and that is Dr. Helena Popovic from Australia. She is just filled with such wonderful information and speaks from the heart, and I know you're going to enjoy this show where we're going to be talking about, can adventure really prevent dementia? But before I introduce you to her, I want to just recommend that you swing by alzheimerspeaks.com. Check out all of our free resources there, as well as going to our sister site, Dementia Map, which is a global resource directory that you can go ahead and mine lots of great information. And if you have a service, product, or tool, you can participate in that as well. And then, of course, I always like to give a shout out to Twiddle. Twiddle has some amazing sensory products for people who are struggling with sundowning, anxiety, depression, sadness. They can just give great comfort. They also have a product called Adapt-A-Wrap, which is absolutely wonderful too, because it allows you to assist somebody who might be struggling with dressing, might not have the mobility to put their hands over their head, or maybe they disrobe. And so go to their website. It's the number 4 and then twiddlesplural.com. 4twiddles.com. Now let's go and talk with Dr. Helena. Well, Dr. Helena, I'm so excited to have you back with us again. The last show was just amazing. I learned so much and got wonderful comments from our audience as well. You were just jam-packed full of enthusiasm and passion and compassion and insights, and your delivery style is so comfortable and it's just contagious. So thank you for taking the time to be back with us today. I'm really looking forward to this conversation.
Well, thank you. So am I. And it's always a pleasure to speak with you.
Now, for our listeners who might not have listened to the first show yet that you were on, why don't you give people a little bit of background about yourself?
I'm an Australian family physician, and I now focus on dementia, Alzheimer's disease, type 2 diabetes, obesity, because these things are all linked. And I also spent 12 years caring for my father, being my father's care partner when he was diagnosed with Alzheimer's and vascular dementia. And he taught me more than anyone else that it's never too late to make a positive difference. So, I am so passionate about showing people that they can boost their brain, perform at their peak throughout their career, avoid the brain fog in menopause, and defy dementia. We are not doomed or destined to get dementia if we are proactive about looking after our brain. And my core philosophy is that education is more powerful than medication. Our decisions are more powerful than our DNA, and people are more powerful than pills.
Wonderful. I love your sound bites. They're so simple to understand, and they're direct, and there's no cutting through or reading between the lines. And, I think nowadays people are really looking for simplicity. When you get a major, chronic diagnosis, it's scary. And, you'll get pamphlets and all kinds of stuff to read, or you get on the internet and you're searching and you just don't know how to cut to the chase. And you do that really well in a comfortable manner. Now, last time we talked about your first book. This time we're going to talk about your second book now that you have written. Can Adventure Prevent Dementia? A Guide to Outwitting Alzheimer's. And again, I can't wait to dive into this. But before we get started, I'm just wondering, you kind of explained your connection with your dad is the one who got you kind of stepping up and stepping into this space.
Yes.
Have you been touched since we, excuse me, since we talked last by other family members or friends who may have gotten diagnosed that maybe you didn't bring up?
Yes. Sadly, a lot of friends, patients I see all the time. So yes, I'm constantly talking about this every day and hopefully helping people. I'll just tell you a brief story. I did have a friend, colleague who referred somebody to me, and they had been diagnosed with Alzheimer's, and something just didn't feel quite right to me. So we went through some questioning. Turned out he was a huge snorer. His wife, and he were no longer sleeping in the same room because it was just, she couldn't sleep. And I said, has he been tested for obstructive sleep apnea? No, he hadn't. He was tested for obstructive sleep apnea. No surprise, he was diagnosed with it. He was started on a CPAP machine, and a few months later, his Alzheimer's disappeared. It wasn't Alzheimer's. It was the fact that his brain was not getting oxygen throughout the night. And that was what was causing his memory loss and his poor focus and his poor concentration. So people are still getting misdiagnosed, and it's really important that we don't jump to conclusions. Memory loss is not just getting old. Memory loss is not necessarily dementia. There are so many other things we have to exclude. Alcohol, vitamin B12 deficiency, it could be hydrocephalus, could it be a tumor? We just have to go through, could it be an underactive thyroid? Could it be poor sleep?
Yeah.
So, these things are critical.
Hydration,
Yes.
food,
Yes.
medications. I mean, the list really goes on.
Oh, yes. Taking people off medication.
Yeah.
Can improve their cognition, because as we age, we need a lower dose because our kidneys and liver aren't as good at detoxifying and eliminating them. So it's really important to review people's medication. Do they still need this? And do they still need it at such a high dose?
Exactly. Well, I'm so excited, like I said, to dive into this new book of yours. But before we do that, why don't you just highlight for our audience what your first book was about, In Search of My Father? And I think that might be helpful for people just to know us as a resource, and then we'll go ahead and talk about this one.
All right. Well, In Search of My Father the subtitle was Dementia is No Match for a Daughter's Determination. It was really my story of getting thrown into the role of caring and how I started in complete ignorance and bungled my way through and ended up searching for the man beyond the dementia, the grief, the depression, the diagnosis. And it brought together all the things I had learnt to help people boost their brain and to help care for somebody with dementia. And it was, part diary, part research, scientific research, and it was woven together with humorous stories so that it was very readable and digestible, and people would not just learn a lot about how to care for somebody, how to care for their own brain, but they would also be able to relate, because the two most powerful words in the English language are me too. I wanted people to be able to look at the situation and go, yes, I've experienced that too. That's how you handled it, or just to be able to laugh.
Oh, and laughter is such good medicine. And to me, it's the core of most relationships. It's kind of the glue that holds us together when times are tough. And yet I have noticed in my experience and talking with others around the world, it's a lot of times the first thing to go, because everyone's like, this is serious. And,
Yeah.
and it's like, and we can't lose that. I mean, it is so powerful, and life is still funny, and goofy things happen. And some of the most humorous things with my mom are my deepest memories.
Yes.
They bring me joy. it's not laughing at them, it's laughing with them. It's just, it's those goofy things in life. And yet there's kind of a stigma with that too, I think, out there, that you're laughing at them, and it's like, no, we're in this
Yes,
all together.
yes. One thing people may or may not realize is that changes in a person's sense of humor actually can occur 9 years before a diagnosis of dementia is made, because that is one of the things that is affected, because we start to process things differently, perceive things differently. So if you notice a person's sense of humor changing, they find things funny that they didn't used to, or vice versa. That's just something to look into. I'm lucky my father never lost his sense of humor. And one of the things I did to try and preserve that and laughter was, we kept two boxes. We had a gratitude box and we had a laughter box. Anytime something happened that was funny, I'd get Dad to write it down, or I'd write it down, and we'd put it in the laughter box. And anytime something happened that we were really profoundly grateful for, we'd write that down and put it in the gratitude box. And World Alzheimer's Day, which is the 21st of September, also happens to be World Gratitude Day. And so every 21st of September, we would sit around the table, me, my partner, and my father, and we would read what we had written throughout the year. And it was better than Christmas. It was just so heartwarming. And I don't think I have dementia, but you forget the things that you feel so profoundly grateful for. We need reminders, not just the people with dementia. And the other wonderful thing, I had told a girlfriend about this. Gratitude is contagious. And because when we feel grateful, we actually perceive the world differently. We notice more things to be grateful for. It improves our mood, our coping skills. It lowers our stress levels. Just having that attitude of gratitude. And we need to be actively looking for it. And because of the gratitude box, we did actively look for, it reminded me to actively look for things that we were grateful for. And, at the end of the day, isn't it lovely how they served us? They were so kind to us at the coffee shop. I feel so grateful for that, or whatever it happened to be. And with the laughter box, we just, randomly picked, I used to do it on Dad's birthday, that we would read all the things that we'd found funny in the previous year. And that was, that then led to other things. And sometimes we were just in stitches, and you don't often anymore have that laugh, that really big belly laugh where you're actually using 300 of your muscles, which is, a good workout, by the way, where you have those tears coming out of your eyes, and you honestly feel like you've had an internal shower, and you just feel so refreshed with laughter. And I think that is something, I've both my books, I make sure that there is a lot of humor in them, because that is so important.
Yeah, I agree. When I was thinking, I love the laughter box. I'd not heard about that. In the gratitude box, I had a little crystal, bowl that I put stuff in, and then I had a gratitude journal. But yes. I kept that to myself. I didn't really share it, but I love the sharing. I think that is brilliant. The other thing I want to say is kind of in that being serious mode with the chronic illness and not laughing. I have a great example of that. We were going up to the cabin, and my mom fell in kind of the vestibule area of the cabin. And my daughter and I were in there, and we were trying to get her up, and we couldn't get her up. And then my husband came in afterwards. It was like Christmas. We were going up there. And so he came in behind us, and he sees my mom on the floor, and he is so anxious to get her up off the floor. And he's like, and my mom and my daughter, Danielle, and we're just in stitches trying to get her up off the floor. And, she's calm and she's fine. And Tom's like, this isn't funny. We've got to get her up. We've got to get her up. And just that seriousness. And so we couldn't get my mom to understand to like bend her leg, to try to situate her.
Yes.
She's on this rug. And so we're lifting the rug, and we're kind of rolling her off the rug to try to get her on a smoother floor so we could help manipulate her a little bit more. And then Tom and I ended up like lifting her from her shoulders. And my mom there was like a closet, and my mom's walking up the closet.
Yeah.
And my daughter's standing there not knowing what to do. And I'm like, knock her behind her knees. Just knock her behind her knees. So her legs dropped out. And we are laughing so hard. We're just about peeing our pants. And my husband is just like, this isn't funny. This is serious. And it was like, we have to keep her calm because we don't want her any more stunts with all of this stuff. But it was just the different approach to those situations. She wasn't hurt. So we didn't have to deal with that. And it was like, eventually we will get her off the ground one way or another. But, when you're telling her to bend her knee and she's going, okay, and she's bending her finger thinking she's in compliance, but it is really important to be able to look back at those things and go, gosh, we got through it. And this is how we got through it. That's one of my favorite stories, because I can still visualize it. I can still hear the laughter, and this was, my mom's been gone over 10 years and this was way before then. It's probably 15, 20 years ago. But it's still a very, very strong, wonderful memory of us just working together, So anyways, got us a little sidetracked there, but I just thought to make that pop there. Now, it's been like 10 years between books that you've written. And what made you decide to write the second book? Because again, I always find it fascinating why people choose to write it. And also on top of that, there's been a lot of new research and stuff. And so I'm wondering if you can maybe share some things on that as well.
Certainly. Well, firstly, I wrote the sequel, Can Adventure Prevent Dementia? And spoiler alert, it can. Because readers were asking what happened next. They wanted to know the rest of our story. If we got the puppy, how effective were all the strategies I'd implemented to boost Dad's brain? So I felt I had to answer readers' questions, and it was a real pleasure and privilege to do so. It was so lovely that people wanted to know. And the second reason was that I was even more convinced 10 years down the line that education is more powerful than medication. Educating people about what they can do to keep their brain healthy is still more effective than any new whiz-bang drugs on the market, despite the publicity around lecanemab and donanemab. And the other really important reason I wanted to write the book is because I do not agree with the dire predictions about an impending tsunami of dementia. It gives people a sense of helplessness and futility. Dementia need not be the disaster that is splashed across media headlines if we show people how to be proactive about boosting their brain. And unfortunately, when I say this, the media, when I'm interviewed on radio or TV or just in person, I'm sometimes met with accusations of giving people false hope. My answer, there is no such thing as false hope. Hope is hope. It's not a guarantee, but it's a window of possibility, and it motivates us to try. And as it turns out, the mere act of trying, questioning the status quo, attempting something new, stretching ourselves, leads to improvements in brain function. Even though we don't have all the answers yet, we can't let what we don't know stop us from doing what we do know. And I felt the doctors are still sadly practicing, have you heard the term, diagnose and adios? In other words, they tell their patients there's little that can be done apart from maybe trying one of these new drugs, which has significant side effects and doesn't lead to any improvements. And yet, what are termed lifestyle choices, what we eat, how much we move, the quality of our sleep, our stress levels, social interactions, leisure activities, and so on, they make a huge difference to our brain health, and the medical profession is not talking about it. So I wanted to give people a step-by-step guide to staying as sharp at age 90 as they were at age 30, a guide to preventing dementia and to slowing, if not reversing, the disease after getting a diagnosis. And I do believe I've done that because people have told me that my book, Can Adventure Prevent Dementia, is their Bible of brain health.
Oh, that's wonderful. Two of my pet peeves, I guess, in the industry are, one, marching down to Congress, and it's changed now. But when I first did it, it was all about very, very old people in their very end stages that can't communicate and aren't mobile. And I thought, this is disgusting. You don't even know who your audience is, who is actually getting this, that younger people are getting this and how it's affecting families. That needs to be told. And then the other thing that just drives me bananas every year is the longest day. And the longest day is always this doom and gloom. And so every time on the longest day, I'm like, this is an opportunity for us to have more time to create wonderful moments, to be hopeful, to be grateful, to enrich our lives, instead of, give me your money. And, we have to find a cure, because there's no hope. There's no nothing.
Kindness is the cure. We already have a cure, if you know what I mean. Prevention. Modern medicine, sorry to interrupt you, but, is based on the model of waiting until people fall off a cliff and then trying to put them back together. Let's stop people falling off the cliff in the first place, and really, really, educating people about the importance of good relationships and good food and good movement and getting outdoors and nature and all those things. Yeah.
A big difference. What are some of the things that stand out to you as far as research in because again, that drives me crazy too, because there's still so much focus on plaques and tangles, even though, it has been disproven through some major studies. It still seems to be the primary thing that is pushed out there. And there's so many other pieces that I see, and I don't have time to dig into to all of them, or nor do I have access to all of them, because I'm not a medical person. But there seems to be a lot more research in other areas, but we're not hearing about it.
Well, the good news is, in July 2020, the prestigious medical journal, The Lancet, and anyone can have access to this. So if you just Google The Lancet, modifiable risk factors for dementia, The Lancet confirmed that more than 40% of all dementias could be prevented if we addressed 12 modifiable risk factors. And this is non-controversial. The 12 factors over which we have control, that's the critical part. It's empowering, because it means we can all do something to reduce our personal risk. So if you're up for it, I will go through some of the headlines.
Sure.
Yeah. So the first one, some of them I'll whip through quickly, but the first one, head injury, due to concussion, football, ice hockey, even heading the ball in soccer. It causes the brain to shake inside the skull and thereby tear nerve fibers. And if this happens often enough, there is long-term damage. Helmets offer some protection, but not enough, especially if you're a professional and you play the game every day. And women fare worse than men if they suffer from head injury, possibly because we have weaker neck muscles, possibly because traumatic brain injury impairs our estrogen production. We don't yet know why that's the case. But, I'm afraid I think heading the ball in soccer should not be allowed for girls. And I know soccer fans will just slap me around the face, but so many football, soccer, ice hockey, boxers, so many of them get dementia or Parkinson's disease because of the head trauma. So that's the first one.
I'm going to jump in there, because I went to, we had a Super Bowl here in Minnesota one time, and I was invited to go to a conference. One of the agents does something on head injuries, and he kind of highlights something different every year. And this year it was about dementia and head injuries. And I can't remember her name, but it was a very famous gal who was a soccer player. And she talked about the damage of hitting that ball and what it has done to her, and how just skeletal structure wise, women are built different than men. But they went into a lot of detail. And that was one of, back then we weren't hearing as much about these incidents. And like you said, so many of them are preventable.
Yes. So that's just something to be aware of. If you're riding a bike, wear a helmet. The second one, people are going to say yes, they know, but they don't know the detail. Alcohol. We now know there is no safe level. 4 standard drinks per week start to shrink our brain and increase the risk of dementia. And the new Canadian alcohol guidelines are the first in the world to acknowledge this. It was a study, many studies, but a study involving identical twins found that consuming more than 40 grams of alcohol per week, that's 4 standard drinks in Australia, but 3 standard drinks, I think, in the US, per week, not per day, tripled the risk of dementia. That's a massive blow to the brain from what many people would consider a very small amount of wine. And you combine the alcohol with a high sugar diet and you are on a bullet train to dementia. Just a tip, if a person does consume more than 30 grams of alcohol a day, 300 mils of wine, they need to take a vitamin B1 thiamine supplement because they will become B1 deficient, and B1 deficiency puts a person at risk for a specific type of dementia called Wernicke-Korsakoff syndrome. And one night of binge drinking reduces the ability of a fully functioning person, reduces their ability to perform complex memory tasks for as long as 4 days later. And remember that alcohol is more damaging for women for a variety of reasons. We have less of an enzyme that breaks down alcohol in our stomach. We've got smaller muscle mass. All those things are really important. And a really important piece of research has just come out to say do not drink alcohol on a long-haul flight, especially if you're going to go to sleep, because on a long-haul flight, because of the atmospheric pressure, the blood oxygen saturation is less. When we sleep, blood oxygen drops. And when we drink alcohol, blood oxygen drops. And to compensate, our heart has to pump faster, and it puts a strain on our heart, and it will increase the risk of a heart attack. But the study was done in healthy young people. Even they had compromised heart function when they were drinking alcohol. And it was only a couple of drinks. It wasn't a lot. When they were drinking on flights, it was impairing their heart function. And we know what's good for the heart is good for the brain, because I've done the head trauma, the alcohol. The third thing that was really important to keep our brain healthy was not to get high blood pressure. Hypertension is also a risk factor for dementia, because we're not getting enough oxygen and nutrients to our brain. And for the record, sugar is a bigger cause of high blood pressure than salt, because sugar raises our uric acid levels, and that causes the kidneys to retain water. And
I've never heard that.
Oh, yes. Sugar is a bigger driver of high blood pressure than is salt. And if you have a low sugar and low carbohydrate diet, salt is not a problem. And it's the concentration of salt. So if you really like your salty food, drink a lot of water before you have the food, and that will dilute it, and the salt won't have as big an impact.
Okay. Good tip.
Another obvious one, smoking dramatically increases the risk of dementia, and I think we'll find the same with vaping. Mm-hmm. Low education and the importance of lifelong learning and mental stimulation and challenges. And the important thing is do what's challenging and enjoyable for you. It doesn't matter if the next person finds it easy. If you're finding something mentally stimulating, if you're loving it, if you're in flow and like doing your art or your music, learning a foreign language, learning a musical instrument, they are right there at the top of keeping our brain healthy. But, reading complex literature like Shakespeare. With Dad, I introduced him to jigsaw puzzles because one of his main problems was difficulty focusing. So I found that the jigsaw puzzles helped him focus, and we started with, a few pieces, not 50 pieces. We worked our way to 500, even 1,000 pieces. He'd obviously need help, but with the easy ones, he could do them by himself. And one day he came to me running very excitedly, and he said, "Guess what? I finished that last jigsaw puzzle all by myself, and it took me less than 2 hours. And on the side of the box, it says 4 to 5 years." And I don't know where he heard that joke, but he just used to tell everybody because he knew people would laugh. So, yeah. So that was another one. Another risk factor, I think we're about number 7, depression, post-traumatic stress disorder, anxiety, stress, any mental health disorders will increase our risk of dementia. Type 2 diabetes, and midlife obesity. And I mentioned, I think last time we spoke, that was waist circumference, women over 80 centimetres, men over 94 centimetres, that starts to increase your risk. So I don't worry about people's weight. I measure their waist, because the fat we carry in and around our internal organs, our liver, our pancreas, our heart, that fat actually produces inflammatory chemicals called cytokines, which cause widespread inflammation throughout our body and our brain, and inflammation is a core driver of Alzheimer's disease. And I do want to talk about some really, really exciting research that has happened around diet and type 2 diabetes, diet and Alzheimer's disease. I encourage everybody to look up a brilliant New Zealand neurologist. He calls himself the metabolic neurologist. His name is Dr. Matthew Phillips. And he did, now there have been several studies now, but he did a fabulous study testing what is known as a ketogenic diet. Now, people get their arms up in the air and go, oh, ketogenic diet, that's high fat and you're just eating meat all the time. It's not. A ketogenic diet is a therapy. It comes under the umbrella of neuroketotherapeutics. And what it is cutting out all carbohydrates, because our brain can no longer use them as fuel. I also mentioned this in our last interview, but I'll recap very briefly. People with Alzheimer's, Parkinson's, any dementia, neurodegenerative disease, if you do, one of the diagnoses is made by doing an FDG PET scan where they radioactively label glucose, and they see that the brain is not able to use it properly, use it enough like we used to, particularly in the hippocampus. So the brain needs an alternative fuel source to function properly. And the only alternative fuel source it can use is what are known as ketones. And ketones are produced in the liver when our insulin levels are low and when we eat zero or very little carbohydrate. And then our liver produces ketones. They enter the brain, and not only do they provide the brain with the fuel it needs to function, but it also, ketones and what we call neuroprotective. They help to protect brain cells from damage. They reduce inflammation. They help to heal our mitochondria, and they reduce oxidative stress. All of these things are core drivers of Alzheimer's. So, and the good news is you can download Dr. Matthew Phillips, the diet he used in his study. It's called the Metabolic Strategy Plan. Just go to his website. I think it's Dr. Matthew Phillips or metabolic neurologist, and go to the resources and download this free detailed diet plan, which gives you all the diet, all the foods, all the recipes, how to go about it. And what he did was he randomly assigned patients with clinically confirmed diagnoses of Alzheimer's. They were in a hospital, so there was no doubt about the diagnosis, and they were able to control the diet. They gave half of them a modified ketogenic diet, which means it was simple to follow and it did have some sweet food because people with Alzheimer's like sweet food. Or the other group had the usual diet, but it was supplemented with low-fat, healthy eating guidelines. And they each did this diet for 12 weeks. Then they had a 10-week break, and then they swapped diets so they could actually compare 2 different diets in the one person. And all the patients on the ketogenic diet, not only could they stick to it and enjoyed it, but they improved in daily function, quality of life, and cognition. That is more than any drug can do. Wow. So that is just so exciting. I think the ketogenic diet should be offered as a treatment for Alzheimer's disease and all dementias and Parkinson's. So that is so super exciting. And I also write a lot about that in my book as well. So you can get it all in my book as well. But if you just want to quickly, go to Dr. Matthew Phillips. And the other thing that's been acknowledged, I think we've got two or three more things to go. We touched on this, social isolation, loneliness is as damaging as smoking 15 cigarettes a day.
Wow. I've not heard that comparison either.
Yes, that is just shocking. And that's because it acts on social isolation, loneliness acts on so many different levels. It is a stress. It hammers our immune system. Let me tell you quickly it was a study at Carnegie Mellon University in Pittsburgh. 276 healthy volunteers were assessed on a battery of health parameters, their diet, their sleep patterns, their stress levels, their social life. Did they have asthma? Did they have respiratory conditions? So they assessed their health. And then they had cold viruses dripped into their noses and they were quarantined for 5 days. I'd like to see them try that with COVID because they wanted to answer the question, what was the biggest predictor of getting a cold? Was it having asthma? Was it smoking? Was it lack of sleep? All of these things mattered, but the biggest predictor was social isolation. Those who reported having good relationships, feeling supported, developed a cold at only a quarter the rate of people who felt lonely and disconnected from family and friends. And, the Lancet report has confirmed that good relationships halve our risk of developing dementia. So, don't lose touch with your friends. Don't allow those relationships to slip away. It's just so, so important. Oh, can I tell you one more study because this is just mind-blowing?
Oh, for sure.
Positive social interactions even influence wound healing. Now, there were 42 married couples. They were aged between 22 and 77. They participated in an experiment that measured the speed of wound healing. And each couple agreed to have a blister induced on their forearm on 2 occasions. On one occasion, the couple were guided by a counsellor through a positive interaction. They were asked to talk about their honeymoon, all the happy times in their relationship. On the second visit, they were asked to talk about a disagreement. To the amazement of the researchers, the blisters healed more slowly, almost took half as long to heal. They almost took twice as long to heal following conflict than after a pleasant interaction.
Wow.
And couples who are more hostile to each other during both visits healed at 60% the rate of happier couples. So again, with my father, looking after him, avoiding conflict is so important. Yes, keeping him safe was really important. Keeping the car keys away from him, yes, that was critical. But choose your battles because your battles erode both your health and cognition.
Oh, that is so true on so many levels.
Yes.
And what I love about everything that you're talking about is, so often I think with disease we think the person we're caring for or who's diagnosed has to do this, but you're just talking about healthy living for everyone at every age.
Yes.
This stuff should be taught in school. I would love to see this in our elementary schools because I think, again, it gets down to that power of the story. Like adults can hear this and they can rationalize this makes sense, but they don't necessarily apply it. And I think of smoking, I think of wearing our seatbelts. It really wasn't until we educated our kids and they came home and tugged on us and said, you need to wear your seatbelt. I don't want you to die, or, stop smoking because, and it was that heartfelt interaction that changed things. And
yes.
So I really think it's important that we start educating at a younger level because they're just so powerful in terms of their communications, and they're so authentic, and they see the end goal of the importance of it.
Yes, I do go into schools and I also speak to schools, about brain health and how it's important, for kids to study better, and because that's what they're interested in. But and my big one is every soft drink is a bullet to our brain. I won't elaborate on that here because I spoke about it at our last interview. But Kids go home and tell their parents and want to stop their parents drinking soft drink. The feedback I've gotten from the school is, all the parents are saying, what's this about soft? My child won't let me drink soft drinks. My child doesn't want soft drinks anymore, which is fantastic. But what I try and say is it's a choice. If you want to drink soft drink, the price you're going to pay is you're not going to do as well in your exams. You are not going to learn as well. You're going to find studying harder. Is it worth it to you that much?
Well, and it's funny that kids can draw that line where adults will make all kinds of excuses.
Yeah. Yes. Well, the last two, I think if we count them up, I've done the 12. The last two things that the Lancet reported on was midlife hearing loss was a big risk factor for dementia, which I spoke about last time, and physical inactivity, which I also covered. I just want to remind people, we don't get weak as we get old. We get old if we allow ourselves to get weak. Move in every way you enjoy at every opportunity. They're now talking about exercise movement snacks. You don't have to go for 30, 60 minutes in one big hit if you're busy. You can just they've found that people who just run 10 seconds to catch the bus, quickly run up the stairs to get up there faster, just dash across the road before the lights change. Those 10 seconds of exercise here and there, even that improves our physical and mental health.
Oh, that's interesting.
And yeah, go on.
Oh, no, go ahead.
I was just going to say, you've probably heard of HIIT, high intensity interval training. Where you might do 1 minute intense, 1 minute just sort of getting your breath back and doing lighter exercise. That is also more beneficial than doing just 30 minutes at the same moderate rate. So vary your intensity. Get breathless. Get breathless to the point where you can't talk. That's high intensity. Breathless to the point where you can still carry on a conversation but not sing. That's moderate intensity. So mix them up. And there's another new phenomenon called SIT, sprint interval training, where you go as fast and hard as you might run on the spot. Dad and I would do this in the garden, just run as fast as we can on the spot. Or we had a park nearby, so we would just sprint to a tree. You've got to work up to this level of fitness. Sprint to a tree for 20, 30 seconds and then just rest for a couple of minutes. And do that 3 or 4 times a day. Just 3 or 4, which adds up to only 2 minutes of exercise, 30 seconds, 4 times. That improves physical health and cognition significantly. And if you do it within 15 minutes of a meal, your blood sugar won't spike so much afterwards. And I've been able to lower the medication, the medication dose for a diabetic just by doing that.
Wow. Interesting. I always learn so much from you. I just find it fascinating. Well, gosh, these have been great. And, all of these things, it gives control back to people. And I think especially in our world today, people are feeling so out of control. And this gives them something to, dive into. And, you don't have to attack them all. I mean, that would be lovely, to incorporate.
That's right.
But make a plan, do what comes easiest to you and is the most pleasurable, and then kind of expand from there, I would imagine. Yes,
I just pick one. Maybe increase your exercise, maybe reduce your sugar, maybe prioritize, even though it wasn't one of the 12, prioritize getting sleep. I in addition to the 12 that the Lancet report reported on, I would like to add definitely the importance of sleep. Let me ask you a question. Listeners can think about this. What did Ronald Reagan and Margaret Thatcher, what 3 things did they have in common? I mean, they had, what 3 major things did they have in common?
Famous, politics, and
yes.
I don't know what the
politics, which I will sort of tie in with a stressful life. Both of them got Alzheimer's disease, and both of them boasted how little sleep they had. They would sleep 3, maybe 5 hours a night. We now know that consistently getting less than 6.5 hours sleep a night. I don't mean a couple of years while you've got toddlers. I mean, if decades of your life is spent getting less than 6.5 hours sleep, increases the risk of dementia 30%, bang. And we now know that why this happens is when we sleep, that is when our brain detoxifies. We know that, yes, people with Alzheimer's do have a buildup of amyloid and tau in their brain. I don't think that's the cause. I think that is an indication of damage that's already happened to the brain. But sleep is when the brain actually clears amyloid, tau, and other toxic molecules from the brain. What happens is amazing in sleep. When we sleep, the spaces between our brain cells actually expand, and fluid, which is collectively called the glymphatic system, fluid washes through and around our cells, collects up the toxins, dumps it into our bloodstream, and the kidney's eliminated. If we don't get enough sleep and not enough good, deep quality sleep, then the detoxification doesn't have time to happen, and we get a buildup of amyloid, tau, and other proteins in our brain. So sleep is absolutely critical. The other few things I'd like to add is we now know that gum disease, untreated tooth decay, is a significant risk factor for dementia because the bacteria that cause gum disease, called Porphyromonas gingivalis, can travel to the brain and damage areas involved in memory and learning, particularly the hippocampus. So if you have bleeding, receding, sore gums, problems with your teeth, get them treated. Now, I'm proud to say that Australian researchers are actually already developing a vaccine against the bacteria and developing drugs to neutralize the damaging toxins that the Porphyromonas gingivalis produces. But they're a long way from becoming available. So brush and floss your teeth every day. Now, that actually also reminds me, I did leave out one of the Lancet 12, air pollution. Mm-hmm. And that means, we can't always change where we live. But what it means is if you do go for a walk, don't go for a walk in a busy area. You are so blessed in Minneapolis. You've got so many beautiful parks and gardens. I only visited the sculpture gardens yesterday. That was stunning. And Loring Park. And today I'll go and walk around one of the lakes. So you've got beautiful outdoor natural spaces, because when we are out in contact with nature, we don't even realize we're inhaling chemicals called phytoncides from the trees. These chemicals help to lower our blood pressure. Remember, high blood pressure was a risk factor for dementia. They strengthen our immune system, and they make us feel calmer and improve our mood. All of these things boost brain function. Also, when we're gardening, mm-hmm. People always report that they feel better when they garden. One of the reasons is we inhale a bacteria from the soil called Mycobacterium vaccae, and this bacteria actually stimulates the production of serotonin, one of the feel-good chemicals, in our gut and our brain. So we are actually inhaling this bacteria. It improves our mood whenever we garden. And researchers actually found that if you're in hospital, try and ask for a room with a view of nature, because hospital patients who look out onto nature heal quicker, need fewer painkillers, get out of hospital sooner. Likewise, if you're ever find yourself in prison, ask for a cell with a view of nature, because prisoners who look out onto nature get sick less often, are better behaved, get out of prison sooner. So that is another way underestimated powerful force in healing, just nature.
Gosh, I just interviewed a gal called, her name is Elaine Simons, and the show was titled Passion for Distraction. And she wrote a book about love in a time of caterpillars, and she has gotten really involved with the movement of developing butterfly gardens. And she talks about her husband and, how he would look so detailed, even at the bugs, and then the caterpillars as they change. And she said it was just amazing, plus then you get that aroma that you were talking about earlier and stuff too. The other thing I wanted to mention, and I haven't interviewed this person yet, and I can't remember the name, but my mom had issues with her teeth. My mom used to have beautiful pearly whites, and she was really proud of those, but she was also really scared of the dentist because when she was a kid, one of her friends went in for a procedure and never came out.
Oh,
And so she was terrified, of that. And so her teeth were really important to her. But as the disease progressed, she couldn't brush her teeth. She wouldn't let anybody. She's like, "What are you sticking that stick in my mouth for?" She didn't know what it was for, why it was there.
yeah.
We tried the swabs, we tried the mouth washes, we tried everything, and she just wasn't having it. And so I'll never forget meeting with the dentist one day, and he wanted to go in and pull all of her teeth. He's like, and I said, "No, you're not going to pull her teeth." And he's like, "No, you need to pull her teeth. She's going to get an infection and she could die." And I'm like, "She's going to die." My mom and I have had this conversation one way or the other. And I said, "But why?" I said, "No." And he's like, "Well, it'll be covered. You won't have to pay for it." I'm like, "It's not about the money.
Mm.
It's about her comfort and her understanding of her body." "Well, she'll never know." I said, "Yes, she will." And he's like, and for an hour and a half, I argued with this dentist over this. And he said, "Well, how do you think she's going to know?" And I said, "I'll tell you." I said, "My mom used to love to go to Dairy Queen and get a peanut butter parfait until the nuts became rocks. And she couldn't understand why those rocks were in her ice cream. So then we went to a Blizzard where everything is chopped up and fine. And that worked fine until she had sand in her ice cream.
Wow.
And then from there, we just went to McDonald's and got a hot fudge sundae with no nuts. And she was fine. I said, "She knows the feel of her mouth, and she would be devastated if all her teeth were pulled." I said, "Plus, they're going to end up in somebody else's mouth or drawer because she's not going to be able to know how to use them." I mean, we see that all the time. And so I would always prepare people to see my mom because they were used to these beautiful pearly whites. And I would say, "Mom's teeth now, her smile is still beautiful, but be prepared because it looks like a rusted chainsaw with fried rice hanging off it." Because they were discolored, they were chipped, they were broken, but she still had a beautiful smile, and her dimples were there, her giggle. We just have to look at things differently. But the reason I brought that up was a man reached out to me the other day, and he has it's like a three-sided toothbrush. So, it's much easier for people to be able to clean the teeth. And I have to get back with him. But I'll try to put his information up here too, because I just thought it was fascinating because that was one of the struggles that we had. And I didn't know that would be a potential issue down the road that she wouldn't recognize, what a toothbrush was. And maybe we could have started some of that stuff earlier on. And had a conversation about it or come up with some phrases that made it not so scary because, she ended up being in a nursing home and then it was other people brushing her teeth on top of it and stuff. But I've heard that for years about the bacteria. And it's one of those things. Well, it's like so many of these different avenues have been poo-pooed and pushed down. And it was like, "No, it's a pill. It's only a pill can help." And it's like, no, that's not true. Our gut health, our oral health. I mean, all these things are massively important for us to understand.
Yes. Yes.
As far as, these were really helpful. So thank you. I'm wondering if there are some really positive other studies or approaches that you've seen that maybe you can give us some examples of that would give people hope and simple things that maybe they could institute as well on top of what we've talked about already.
Two things spring to mind, two completely different things. The first one is to really try and eat as little ultra-processed food as possible. So not just sugar, but vegetable oils, seed oils, emulsifiers, MSG, chemicals, artificial sweeteners, all of these things. You see, I tell people you can eat any food that you like as long as it is from the land, from the sea, from the sky, or from a tree. Not from a tap packet, not from a tin. If it comes in a box, I throw it in the bin. Of course, it is more nuanced than this, but if in doubt, give the product a miss. Because all these convenience foods, fast foods, junk foods, they're not food. They are chemical concoctions that are toxic. And, you know, people are more, you know, some people are very sensitive to MSG, some people not so much. But just the volume of chemicals that we are consuming are toxic to all our organs, including our brain. And I think one that few people are aware of is the vegetable oils, that olive oil is not a vegetable oil. It's a fruit oil. Coconut oil is a fruit oil. So olive oil is great. I would add olive oil to your diet if you're not eating it, because it is fabulous for brain health. And the omega-3 fatty acids found in fatty fish and dark leafy greens and soybeans, I mentioned that last time. But the oils to avoid are sunflower, safflower, canola, rice bran, corn oil, soybean oil, because they are highly inflammatory. They are high in omega-6 fatty acids, which then displace the good omega-3 fatty acids in our brain cell membranes and cause them to malfunction. And also, when we heat these oils, they produce very toxic molecules called lipid oxidation products, aldehydes, and they are carcinogenic. And one of the biggest causes of lung cancer in China is wok frying with vegetable oils and just inhaling the fumes. So I know that we live in a time-poor world, but try and just stick to the natural, fresh fruit, vegetables. You don't have to be a gourmet chef. You could just steam vegetables, roast them in the oven, drizzle olive oil and rosemary and herbs, and you've got delicious tasting vegetables. You know, same with just, you know, how quick and easy it is to grill a piece of fish or a piece of meat or a piece of chicken. It's not hard. We just have to understand that food really is medicine, and that ultra-processed food, fast food, convenience food, packaged foods are not food.
Yep. And it's gotten, I mean, I remember when I was younger, when the first McDonald's opened in our area, you know, and then it was Burger King and this and that. Now it's every corner has 2 or 3 of them. I mean, and the drive ups, you know, now we don't even have to get our butt out of the car. And the supersized of everything, you know, to boot. I mean, it just kind of goes on. And when you were mentioning about the cooking in the wok, I mean, it was like, you just assume that's healthy. It looks like it should be, you know, with what
the wok cooking is healthy. Just use the right oils. Either use olive oil or coconut oil or even butter, ghee, lard. Animal fats are actually healthy. Eating fat doesn't make you fat. Eating sugar makes you fat. Mm-hmm. Eating fat doesn't cause heart disease. Eating sugar causes heart disease. So that's the first one. And the second thing is to be aware that our beliefs affect our biology. What I mean by that is what we believe about getting old actually influences how we age. Again, I'm going to quote Ellen Langer because she's just a pioneer in this research. She did 2 fascinating studies. One was to actually look at the biggest things that influenced how people aged, and she looked at genetics and lifestyle. And one of the biggest drivers of healthy aging was having sprightly grandparents, not because you shared their genes, but because they were positive role models and examples. So people whose grandparents were always, you know, taking cruises or just going on adventures and driving away for the weekend and just doing volunteer work and being active and joyful. Well, children thought, oh, getting old is fun. You do all these great things. Children who visited their grandparents in aged care residences, you know, whose grandparents were very frail and didn't do anything, they aged much worse. They tended to go in the same direction because that was their perception of what it meant to get old. So in a lot of ways, our culture teaches us how to age. And you know, another one of my phrases, I mentioned last time, grow bolder, not older. Talk about being welderly, not elderly. And rather than talking about seniors, old people, elders, it just, this is what's positive about, traditional Asian communities. I was a Rotary exchange student in Japan for 1 year when I was 18 years old in my gap year between high school and university, college. And I was amazed at the amount of reverence that the oldest member of the family received. They were a source of wisdom and advice, not irrelevance and frailty, which is how we tend to treat old people in Western cultures. And the old person in the household in Japan, the oldest person, they got to use the bath first. They were served the food first. They were given so much esteem. Yeah. And it makes so much difference. So that was the first study by Ellen Langer. And the second one, she actually questioned people in, young Americans and young deaf people and mainland Chinese people about what their attitude to aging was, what they thought aging meant. And interestingly, deaf people and mainland Chinese don't associate memory loss with aging, whereas, the average young American does. And it turns out that deaf and mainland Chinese far less likely to have memory problems as they age than Western people. And it's related to their beliefs about what it means to get older.
Sure. Well,
so this is how just by being the best version of you, being optimistic, remaining active, being a good example of how you can age in a positive way, just by doing that, getting out there and being active and joyful and contributing, that teaches other people that old age isn't doom and gloom. One of my pet gripes is our anti-aging culture. Why should we be anti something that is inevitable for all of us? Unless you throw yourself off a cliff at the age of 20. I'm pro-aging because the alternative is dying young. Let's celebrate aging. Let's celebrate what we've learned, the joyful experiences we've had, that we've actually made it as far as we have. We have to stop blaming our age and our genes for our limitations, because how we think about aging affects how we age. So I tell people that, what's the first step in aging better? Start to feel better about aging. And one of Ellen Langer's proteges, I think it was, her name was Becca Levy. She did a study to look at all the things that influenced how long we lived. And so she looked at, diet and exercise and high blood pressure and all the usual things. And she found that the biggest predictor of living longer, and let's not make no bones about it. If you exercise and if you have maintained good blood pressure and if you eat well, that definitely extends your life. But what extends your life even more is having a positive attitude towards aging. Those who continue to set meaningful goals, who were grateful for what they still had rather than complained about what they were losing, they lived on average 7.5 years longer than people who are always moaning and groaning about their aches and pains and how terrible it was to get old. This is great news because it means you don't have to worry about all those complainers in your life because they'll be dead long before you. So really, we've got to change how we view aging.
Oh, I totally agree. And it really is, our perceptions are everything about that. And, when you were talking about, accepting our aging, well, when we're accepted, when we accept ourselves, then we feel accepted in community.
Yes.
We're not always trying to constantly fit in and mold to meet somebody else's expectation. Because a lot of times their expectation isn't even what we think it is, because we've never had the conversation. And so I look at all the things that people are doing to their bodies to look younger and be younger. And I'm like, a wrinkle's not so bad. I still color my hair right now, but I'm getting more gray, and I'm starting to think, well, maybe it's a few more years, it'll probably just be white, and that's okay. Right now I'm kind of in that mousy color that's goofy and kind of going with that. But it's like I don't know. I think age is what you make of it. I loved when you talked about, the word choice of senior versus elder and how that is looked at. And I never really realized that difference until I was selling real estate. And I sold a house to an Asian family. And the mother was going to come and live with them, and the mother got the master bedroom. I mean, it was everything. It was honoring the mother, and I sat back and went, wow. I mean, because I had never experienced that in our American culture
Yes.
at all. But it is, people are so full of wisdom and so much wiser. I just think of even for myself personally, how anxious I was as a parent and how like off the shoulder everything goes now that I'm a grandparent. It's like, but I see my daughter in a tiz, but there's that wisdom and that calmness that comes through, and that stuff needs to be honored for sure. And again, it's was it Breen Brown had said something, it was one of her videos. I love them, but she was talking about
Who's this?
Brene, yeah.
Yep.
And she did she was doing a talk, and she said, I did this study about fitting in. And she said, but what I realized, we all talk about how we want to fit in, and she says it's not that we want to fit in. Fit in means that we have to change. She said we just want to be accepted for who we are.
Yes.
And there's a huge difference, in that. And, and again, we can apply all of that back to each and every one of us, including those living with dementia. That's something that goes across all bounds. And I think so often with dementia and chronic illness, we tell people how different they are, or aging, you're in this category now. No, you're still a human being, and you still live a fluid life, and you still have choices, and you still have value, and you can still participate. And I get really tired of the characterization. I understand it to a point.
Oh, yes.
But it does so much damage to people at all ages. Well, we're going to take just a quick little break here, but we have been talking with Dr. Helena, and again, she is just so full of fun facts, great little tidbit snips that we can remember, and empowering us to take control of our lives, and knowing that we don't have to rely on somebody else. There's a lot of choices that we can make, and we don't have to do it all. We can pick and choose. And I think that's one of our, as far as people, we're like, oh, I can't do it all, so I won't do anything. And you're like, no, you don't have to do it all. This is a menu of choice,
Yes. Just one thing at a time. And when people say they introduce exercise into their life and they see how much better they feel, then they feel empowered to try the next thing. Maybe now I'll change something in my diet. I'll get out more in nature. I'll meditate more. So one healthy habit leads to the next.
Exactly. So again, you can go to her website. She's got a couple. She's on Facebook and LinkedIn and Instagram and YouTube. We'll have all of that in the show notes for you. We are going to hear a little bit from Q for Good, which is a company that builds websites and supports them, and just does an absolutely fantastic job. And we'll be right back. I also want to introduce you all to Q Blocks. They have been absolutely excellent to deal with. They have been in business for 18 years, and they serve the globe. I can't say enough good things about this company. I've had a lot of bad experiences. I don't know about you with tech companies. They have made a very complicated process very easy. And their staff is so kind, so polite, so respectful to work with. And, when I am frustrated and ready to pull my hair out, they just smile and tell me everything's going to be okay. And they really are just on top of the communication, which alleviates so much stress. as an owner when you're dealing with tech issues. You can get a 10% discount. Visit them at QBlocks, that's CUEBLOCKS.com, or you can email them at letstalk@qblocks.com. For that 10% discount, just put Lori, Lori, in the inquiry form. And again, I don't think you'll be disappointed. I surely haven't been. I can't rave enough about this company, and that's kind of rare these days. Okay, so I wanna talk to you a little bit more, because you're not caring for your dad anymore, and I had a really tough time after I lost my dad with brain cancer. I didn't know who I was anymore, and when I lost my mom, we just get into these roles. So how do you focus your time and energy? For me, I had to figure out who I was all over again, because I made the mistake of not holding on to my own identity.
Well, for me, Dad actually opened up a whole new world of medicine, and people started to ask me to speak at conferences about what's it like being a daughter and a caregiver and a doctor. How do you balance those roles, and what are you doing? So I started, because of Dad, to speak at conferences and do workshops about how to boost your brain, speak at community groups, libraries, about my book. So, and when he was around, I would take him with me, and that was just the joy and the pride. That's my daughter up there. Was just wonderful. And I always used to sit him next to me when I was selling the books, and I would sign the book, and then they'd pass it to him, and Dad would sign the book. So that was just so beautiful at the time. And when he passed away, I've continued that. He's not there with me anymore, but I've just ramped that up, because that is, I feel my purpose is to empower people to take charge of their own health, to spread the message that we need more education, not medication. That medication, I don't believe, will cure this disease, at least not anytime soon, but education about how we live our lives, how much we move, our stress levels, all those things that you and I have talked about, they have the potential to not only prevent dementia, but to improve and even reverse the disease in those already diagnosed. And I just want to say, even if you have the ApoE4 gene, you are not doomed. Chris Hemsworth, I hope you're listening. He's publicly announced that he actually has 2 copies of the ApoE4 gene, and I know he has brilliant doctors looking after him. But nonetheless, 2 copies of the ApoE4 gene can increase your risk of dementia tenfold compared to somebody without those genes. However, what research has found is that if you do regular physical exercise and if you maintain a positive attitude to aging, your risk is not, those genes do not determine your fate.
Yeah.
Go on.
I was going to say, I had a friend here in the States who was a doctor, and he always had a phrase saying, my genes aren't my destiny.
Exactly.
And he lived by that rule. His wife ended up getting dementia. He ended up getting dementia, but my gosh, not till he was 85, 90 years old. And they would make games of things. When you had talked about standing in line on one leg, he and his wife would brush their teeth on one leg, and then they would switch.
Yes.
Or they would use the opposite hand, or
yes,
or they would go out to dinner and they would make a game of it. They would ask the waiter to give them a bottle of wine, and then they would try to guess what it was and what were the ingredients in it and stuff. So they, to keep
lovely,
just looking at life a little bit different, but still making it fun and not giving up. And I think that is so important on that. So I'm sorry I interrupted you there.
No, not at all. So I spend as much time educating health professionals and aged care providers as I do the public that we can boost our brain and defy dementia. And I also emphasize, a lot of people say, oh yeah, but it's so time consuming and labor intensive and difficult to implement dementia prevention strategies in our super busy, time poor world. we always make time for what's most important to us. I think we live in a society that has been taught not to take responsibility for our own health. Just, you wait till you get sick and then go to the doctor and they'll give you something that may or may not work that's really a Band-Aid. So I just think getting people to really realize that your health is in your hands, your decisions are more powerful than your DNA, and even things like a study where they got people to play computer games, and what they did was they flashed positive age-related words so quickly across the screen that they didn't even recognize that they were seeing them. Wise, sage, experienced, valuable. So all positive words related to aging. And they tested their memories before and after and their attitudes, and they did this over a period of 4 weeks. They found that at the end of the 4 weeks, their health was better, their balance was better, their physical and mental health was better, and their memory was better. And this was just because now they had been just even unconsciously primed to view aging more positively. So I think that is also an absolutely huge message to get out there. I mean, in our advertising, even the way we speak down to people that are older, we change our voice. It's sort of almost baby talk. It's just, we have to stop that. We have to catch ourselves.
Yep. And again, we have to slow down so we can even be conscious of
That's exactly right. That's exactly right. So, I encourage people, go to my website, drhelenapopovic.com and adventurepreventsdementia.com. You can download a free guide that summarizes the most important things about what dementia means and what we can do about it. I write a weekly blog, which is free, with any new information that comes out. And of course, read my books. And I also actually have what I call wild cards, and they are 20 cards with a picture and a brain boosting strategy on one side and an explanation on the other. And there's also a lot of a PDF of games that you can download from my website that you can play with these cards. So just so many free resources and, tons of videos and interviews and presentations that you can binge watch if you are so inclined on my websites as well. Just want people to start to get the message that we can do something about this.
Well, and the cards are smaller, so they fit in a purse or a pocket, real easily and stuff, the way you have them. The other thing I want to mention that I think is really important, and I just think this is so overlooked in the big picture, is you talked about, your education. You educate everybody, people living with dementia, their families, professionals, the whole 9 yards. And I've kind of been screaming this from the rooftops. We will never make sustainable change if we're not inclusive of all voices.
Yes.
Because we all impact one another. And there's been this, and I don't know if you run into this. I still run into this, and I really encourage people to broaden their mindset. But, we can't have family in with staff, because they're worried a staff person might say something that they would be embarrassed about or think was inappropriate. And it's like, if you have a good facilitator or speaker, they'll use that as a training tool.
Yes.
So, that's a really common belief. And same on this side. This is a common belief.
Yes.
Expose those things. And then you hear this sigh of relief because you're having an authentic conversation. Everything isn't perfect all the time. Never was before dementia. It's not going to be in the future. That's just life. But I just think it's so important for people to hear what the other side has to say and what their perceptions are. It cuts through the chase, and it elevates the learning, and it builds, in my perception anyways, it builds a team, a much stronger team going forward, of a team that may never have existed prior.
Yes. And look, I learned so much from my patients, and when it's really important, I think, for staff and families to get together, because staff, I'm sure you are too, we are understaffed. They are understaffed, they are underpaid, they are run off their feet. And so it's not surprising that working in a hospital, in an aged care residence, you just want to make sure that they're fed, that they're showered, that you tick the boxes. And I know a lot of them would like to sit down and have a meaningful conversation and get to know their patient, but there just isn't the time. And so it's important for families to hear that the medical profession and all the allied workers, the nurses, the carers, they're all doing their best, but they're all stretched to the limit. And understanding the difficulties that both sides face, that is just so important.
Yeah, when my mom was in the nursing home, they had approached me, the executive director, and said, I want you to take over and see if you can get our family council back together, because nobody wants to come. And I said, well, yeah, I understand why. And he's like, well, what do you mean? And I said, you don't accomplish anything. I said, I'll do it. I said, but I want to make sure that every month I have a different director in the meeting. I want maintenance. I want nutrition. I want housekeeping.
Mm-hmm.
I want the receptionist. I want you. I want the social worker. And they're like, well, why would you want that? I said, you have no idea how many problems you could get rid of instantaneously by having a conversation. And they were all shocked. Housekeeping came in and, somebody wanted like a label maker because they could never find their person's clothes and it was in somebody else's thing. They're like, oh, well, we can do that. Or, family was getting frustrated with, can I hang a picture? And then I got yelled at afterwards. And it's like, the maintenance people are more than glad to come in and do some of those things, and take care of it. But, and the executive director, he was always so great with me. I know I drove him crazy, but he would say, well, they can leave a message, they can email, they can call, we've got a box of suggestions. I'm like, no, they need to meet face to face.
Yes,
and
yes.
From that came this group of people that wanted to step up and help. And so we ended up raising funds, and we built this beautiful, beautiful waterfall and patio area, and it was gorgeous. And we found out that we had 2 master gardeners. Well, they took over and they cut their budget because these people wanted to volunteer and get out there and do those things. We had people volunteering. I'll buy a bench, I'll do this, I'll do that.
How wonderful.
And it was so natural, and there wasn't this like, oh, I hear their voice, I'm gonna dive into a room or run down the hall. Don't tell them I'm here, because it got rid of all of that conflict by just having those open conversations and being able to see things in a different light and being open to them. And it really changed how management did things from, again, allowing that, but in terms of really listening. And I know for me, I pushed, because I'm kind of like you. I'm not going away, I'm going to get out there. So when they were, there was one of the things that they had done was when we built this beautiful waterfall, and then they decided, oh, they're going to change everything. And they were putting all the people that lived in the nursing home at the back side of the nursing home. So it faced an alley with a fence. And we're going to put all the transitional people in the front, because they knew the social workers and the family would all want to come in. And I went in and I just scolded them. And I said, that is an absolutely horrible decision. I said, first of all, the people in transition need to get up and need to be mobile, and that's an excuse for them to walk that way.
Yes.
And I said, it's disgusting. You are putting your main people kind of in the dungeon. And I at that time I had bought like bird feeders and things like that, and I was trying to get the squirrels going, because at least then my mom could see that. Well, after talking to me, he talked to his boss then, and they ended up investing. There was like 2.5 feet between the alley and the fence, and they put in all these beautiful flowers and bushes. And so it didn't look like an alley anymore. It looked like a garden.
Oh,
And people
wonderful.
would and so people would sit in their rooms and again be more relaxed. They had less sundowning, all of those types of
Hmm.
things. But again, opening up those conversations and changing the way families feel in terms of being heard, can have big
Yes.
impacts
Yes.
on all of this. So
Just
again,
feeling heard. Just feeling heard.
yep,
So much difference.
yep. Or we're hearing too now of, and I'm not hearing it as much since COVID, but there were a lot of people with dementia that were really talking a lot about, I want to volunteer in different places so I can figure out if I ever have to move where I'd feel comfortable.
Ah,
And, you know, there, it's just endless of the possibilities when you're not scared,
yes, yes.
when we can remove some of those stigmas and things there. So, um, gosh, I'm trying to think what else I want to ask you. There's so much I want to talk about. We kind of talked about implementing different strategies in a busy world. And you gave us some good tips of just 30 seconds, running fast and then settling down, and how those things can play in. Are there any other things like that that you'd like to share with us, that might help people step into taking control and, of some of their um, health needs?
Um, just taking time out to be quiet, breath work,
Mm-hmm.
being still, has actually been found to improve mental and physical health, lower blood pressure, strengthen the immune system, and even improve cognition.
Mm-hmm.
And there are a couple, they actually tested Dr. Andrew Huberman, Stanford. He was one of the authors in the study. So they actually compared 3 breathing techniques and mindfulness meditation. And the reason I mention this is you want something quick and easy. And I think this is one of the most powerful ways to start your day.
Mm-hmm.
They just did 5 minutes of either meditation or box breathing, which is breathe in for 4 counts slowly, hold for 4 counts, breathe out for 4 counts, hold for 4 counts. So you just circle that nice and slowly for 5 minutes. Or the second one was cyclic sighing. You breathe in as much as you can. So, and then when you think you've breathed in enough, you breathe in just a little bit more. And then you breathe as slowly as you can out.
Mm-hmm.
And the third one was simply breathing in normally. So breathing in slowly and breathing out at a normal pace. That was the least sort of effective in the breathing exercises. But the box breathing and the cyclic sighing were more powerful than meditation in improving mood, reducing mental health issues, reducing anxiety, and improving cognition. So I encourage and the reason being, whenever we take a very slow out breath and we control our breathing, we're controlling something that we're not usually conscious of and don't even realize we can control. So it's, firstly, it sends a message that I can control things about my body.
Mm-hmm.
And secondly, it activates the parasympathetic nervous system, which is our rest and digest, which is opposite to the sympathetic nervous system, which is the flight, fright, fight.
Mm-hmm.
And so by activating our parasympathetic nervous system, we feel calmer, we digest our food better, we just, able to make calm, rational decisions better. So that would probably be one of my top tips. Start your day with 5 minutes. And I find that easier. I like, the cyclic sighing was found to be the most powerful of all. So I try and start every day with just 5 minutes of cyclic sighing. I find that easier than meditation. With meditation, my mind's just going to start going on to all the things I should be doing and not sitting here doing nothing. Whereas when I'm actually breathing, I'm focusing on something, it kind of engages my brain without engaging my brain in thinking.
Mm-hmm.
So I think breath work.
Oh, I'm a big believer in breath work. And in fact, I have a friend, Lori Ellis Young. Her and her husband, George Ellis, wrote a book called Breath is Life. And
Mm.
the subtitle is Taking in and Letting Go, How to Live Well, Love Well, and Be Well. And they actually have gone over to Ukraine and
Wow.
are helping with the trauma over there in terms of teaching people breath work. And for me, one of the
Amazing.
biggest things that I learned through her teaching was letting go of stress, which both people with dementia and care
Mm.
partners and professionals all feel.
Oh,
Everything
yes.
is escalated these days. So for me, what I do is I do 11 deep breaths in. And when I breathe in, I ask my higher power, it can be God or whoever for you, to give me whatever I need. And I
Mm.
used to ask for specifics because, of course, I thought I knew what I needed. And I no longer do that. And I just let my higher power send me what I need. And then on my exhales, I ask for all the toxins in my mind, body, and soul to leave the building. And
Fabulous.
I always feel so much better,
Mm.
so much calmer, grounded to just move forward. And it just, give me what I need and get rid of what I don't, for
Yes,
me.
yes.
But yeah, and I didn't know there were so many different, types
Yeah.
of breathing exercises and stuff too, but they're all
Whatever
fabulous.
works for you, whatever
Yeah.
you feel most comfortable doing.
Yeah, exactly. Exactly. Gosh, in wrapping up, are there some key things that you want to have people walk away with? Everything you've said is just, I, you've just given us such great information. It's just amazing and great resources as well.
Thank you. Thank you. Look, just know that you're not alone, that there are so many other people that are going through this. There's so many great resources um, out there. Your podcast is an endless supply of amazing resources. And I try and do the same on my website. And also, I would probably leave people with every day, end your day with something you feel profoundly grateful for, and
Yeah.
you sleep better.
That's a really good one. There's nothing better than going to sleep with a smile
Mm,
on your face and, and,
absolutely.
and feeling grateful. And then, even in the morning, remembering that to start your day off.
Absolutely.
Yeah.
Absolutely. Oh, the other one too. Lately, I've been talking about the power of positive anticipation.
Mhm.
So ask yourself the night before, what am I looking forward to tomorrow? And if the answer is I'm not looking forward to anything, create something, even if it's contacting a friend you haven't spoken with for a long time, trying a new recipe, taking 5 minutes to find the new flowers in your garden, whatever it is, even starting on a new goal, make sure every day that you have something to look forward to. That immediately elevates our mood and energy as well. So think about it the night before, and then when you wake up in the morning, remember the thing that you are looking forward to that day. It'll just set you off on the right foot, and add something that you feel grateful for. I top and tail my day with gratitude as well.
Yep. Well, and that's so important. Like for me lately, I have had so many goofy technology things and stuff. And I found myself, I'm spinning in it instead of moving through it. And I think I'm manifesting even more of it. It's like, oh, everywhere I turn, I feel like I'm getting slapped with it. Well, and I'm saying that in words when I'm talking to people. It's like, oh my gosh, and it's like, well, hello, you're becoming a magnet, you idiot. You know that. You know better than that. And so thanks for the reminder on that. Hopefully I can move myself forward in all of this. Well, again, thank you so much for your time today. I just feel so blessed to have spent this much time with you, learned so much. And I just can't believe all that you are doing, to help so many people on so many levels. So keep up the great work. Again, for our listeners, please be a giver of hope. Like, click, and share. Pass this information on. If you felt good listening to this, others will too. And we all need to be lifted up. The knowledge base of which Helena gave us was just exceptional. And, make sure that you run out and order her book, go to her websites, and feel full. And, be a connector yourself. You're filled with information. Don't keep it a secret. That doesn't do anybody any good.
No.
So all of the links are in the show notes. So feel free to check those out. And, if you're looking for a speaker, reach out to her, and she would love to talk with you as well. So thanks, everybody.
Thank you very much.
Have a great week. Bye-bye.
Bye.
Hi, I'm Lori LeBay, and I wanted to tell you about Alzheimer Speaks, which is another great podcast. You see, my own mother lived with dementia for 30 years, and I felt lost. Did you know every 3 seconds someone in the world is being diagnosed with dementia? Odds are it's going to hit your families too. We want to help you connect to services, products, tools, research, and stories so you can be prepared. Please subscribe to Alzheimer Speaks on your favorite podcast platform.